Explain to us what's going on here, and when someone has osteoporosis, what are they experiencing in their bones?
So you see the brownish area in the top of the hip where the ball and socket is, okay? So that area in that bone area is a spongy type of bone, and that starts to demineralize, as we talked about. It loses calcium and some of the minerals that make it strong. And as people stop walking and they stop exercising, there's more risk for that to even occur. And so what can happen is you can get a fracture in the neck of that bone, and that's one of the risk factors for osteoporosis. When we do what's called a bone density study, we're looking at that femur. We're looking at the neck of the femur, and we're looking at the mineralization of it, and we're comparing it to a young, healthy person's mineralization. And then we can score people on that and say, your risk of fractures is 20% or 50%, or you have normal bone, for example. But we want to look at that risk factor. If it gets too high, then we want to put people on medication to either replace some of the calcium in the bone or stop that demineralization process and slow it down. There are various methods for that.
And there are common symptoms for osteoporosis as well, starting with back pain, loss of height over time. Some of these you have mentioned. So talk to us a little about these, Dr. Tolchin.
So the back pain, as I mentioned, when you start developing osteoporosis, your posture changes, you get slumped over. And so that puts strain on the ligaments around the spine. It puts strain on the small joints in the back called facet joints. It puts strain on the disc. So that's all reason to have back pain. And then as those bones start compressing down, if they do it subtly, it's not so painful like a compression fracture, the last item on the list. But it may happen over time. People say, I'm shrinking. And usually women will say, I've lost height, I've lost an inch or two. And that's because of the osteoporosis starting to shrink those bones and compress them with time. And then they have the back pain, the stoop posture, and ultimately can have a fracture if it's bad enough.